Great. Good. Okay, thanks for that little advertisement.
Yeah.
So, I want to welcome everybody here today. Thanks for coming. It's snowing here on campus, so appreciate the fact that people actually came into the room, but we know we have some people online as well, so I want to welcome you. And I'd like to begin by acknowledging that the land on which we gather today is the traditional unceded territory of the Struik Okanagan Nation and their people. And it's really quite beautiful out today, so a special thanks to them for allowing us to be here. My name is Joan Batorf, and I'm Director of the Institute for Healthy Living and Chronic Disease Prevention, and delighted to host this Partnership in Research seminar today. We will have time at the end for questions and comments. So for those of you who are online, you can type in your questions in the chat box. For those of you in the room, we'll just get you to speak up loudly so everyone can hear. This is an especially important topic this week because, for those of you who may not know, this is National Non-Smoking Week across Canada. And it's a week where we raise awareness and encourage people who are smoking to think about and start maybe a first attempt at quitting. And tomorrow is Weedless Wednesday as part of Non-Smoking Week, and it's a day where we like to encourage people who smoke to take the day off and have a day without smoking. So you'll see a fair amount in the media this week around smoking, the health effects of smoking, and all of the resources that are available here in Canada and elsewhere to help people stop. So it's really great to have this presentation today by my colleague, Dr. Laura Struik, who is Assistant Professor here in the School of Nursing, to talk about vaping, because this is also a new and emerging challenge for people who are working in the tobacco control field, and is really gaining a lot of attention in the community as well as among researchers and health professionals. So without further ado, I'm going to let Laura take it over to tell us about what she's learned about tobacco industry tactics for drawing youth into vaping. Laura.
Thank you very much, Joan. Hello, everybody, and welcome to everyone in the room as well as those online. My name is Laura Struik, and I'm an assistant professor for the School of Nursing here at UBC Okanagan, and it is a pleasure to be here today to talk about vaping at large, which has been an emerging and increasingly concerning issue, as I'm sure many of you have been inundated with news feeds about vaping, both what we do and don't know about it, and then also talk about a study that I led. And the purpose of this study was to look at how the tobacco industry may be gearing their advertisements towards youth to draw them into vaping. So let's just start off with what is vaping. So a vape, or an e-cigarette, is a nicotine delivery device. So this is where liquid nicotine is heated up by a battery and is delivered to the body through a vapor. In contrast, tobacco smoke through a traditional cigarette is lit, and the smoke, the tobacco smoke, delivers nicotine into the body through a smoke. And so that's the difference between how these products are ingested. And I just wanted to go back about how it came about. So it has a long history, even though it's only recently become a modern trend. Way back, herbs and tobacco used to be vaporized. We know vaporized tobacco as hookah or shisha. And it really wasn't until 1963 that the first non-tobacco e-cigarette was invented, but it wasn't actually brought to market. There were about 40 years of research that happened between then and 2003, which is when the first e-cigarette was introduced and brought to market. And this was brought forward by a Chinese pharmacist named Han Li. And his inspiration to bring the e-cigarette to market was because his father had died of lung cancer due to smoking. And then in 2006, it was brought into North America, And in 2008, it was deemed a cessation aid, so something to help people quit smoking. And it was only last year that it was legalized here in Canada. That's just a little history on vaping. So we hear a lot of terms around e-cigarettes, vape pens, vape tanks, vape pods. What's the difference, you might be wondering? Well, they are essentially all variations of an e-cigarette. The mechanisms are the same in terms of how they function. They really are just different in terms of look and feel. So the very early e-cigarettes were in the form of a pen, and then they transitioned into the more tank-style e-cigarettes, and now we have the more popular pod mods, and you might see Juul has essentially captivated the market of the pod mod, and in fact, juuling has been synonymized with vaping, especially among the younger demographics. So cigarettes versus e-cigarettes. How are they the same? How are they different? And so I just wanted to look at some key things. So as I had said, in terms of ingestion, they are different. One is a vapor, one is a smoke. In terms of rules and regulations, they are not the same. While they are both considered tobacco products, because e-cigarettes have been deemed a cessation device, they are allowed to be used in places where many cigarettes are not allowed to be used, such as on the streets, as well as in certain indoor areas. In terms of harmful chemicals, we all know that tobacco smoke from traditional cigarettes contains many harmful chemicals. In fact, when a cigarette is burned, there are over 7,000 chemicals, 69 of which are known cancer-causing agents. And in comparison, e-cigarettes, there are likely less harmful chemicals, but we still do not know enough about them in order to make conclusive statements about the degree of how less harmful they are. In fact, recent evidence has indicated there are cancer-causing agents like formaldehyde found in e-cigarettes, as well as harmful chemicals that could burn your lungs, such as glycerin. And really, when you think about it, there are so many different brands and types of e-cigarettes available, and certain degrees of quality in all of these variety of brands, that it's really hard to pinpoint the degree of harmful chemicals from one e-cigarette to the next. So that's another thing to keep in mind as well. In terms of nicotine content, no, they are not the same at all. And I think that this needs to be brought forward in addition to what we do not know about some of the chemicals that might be in e-cigarettes. Nicotine is a very addictive substance in e-cigarettes, and when you think about them in comparison to cigarettes, which I'm going to do right now, it gets very concerning. So one pack of cigarettes here contains approximately 20 milligrams of nicotine. In comparison, I'm going to take the Juul, the popular Juul pod as an example. A Juul pod typically contains 2 to 3 times more nicotine than a single pack of cigarettes. Now, e-cigarettes can range from 0, well they can say 0, but we don't know if it's actually 0, but 0 to 70 milligrams of nicotine. So that, like I said, is up to 3 times more nicotine. And according to Health Canada, anything with 66 milligrams or more of nicotine is considered very toxic. Anything between 20 and 66 is considered toxic. So e-cigarettes are being sold at a toxic to very toxic level. And let's just put this in the context of use. So youth typically use a single pod in a day. So that's equivalent to a chain-smoking, highly addicted chain-smoking adult in terms of nicotine consumption. And so this really makes you wonder, were these really designed to help people quit smoking, to help them get off of their addiction to nicotine? And Dr. Marvin Frank, who works here in the psychology department, couldn't have said it more perfectly, that maybe this isn't designed to help people, it's designed to addict people, and it's working. So who is vaping? Well, while it was designed designed for helping or brought to market with the purpose of helping people quit smoking, it is really the youth and young adults who have never picked up a cigarette that are taking up e-cigarettes. And I don't know about you if anyone has children or no children, but I have a daughter, and I could see her in any one of these pictures. She's athletic, she's smart, she's outgoing, she's social. And vaping is not biased to any particular group. So all of these youth, with their wonderful and different characteristics, are at risk to being pulled into vaping. So let's just look at how many young people are, in fact, vaping. So if you look at this graph here, the green represents combustible cigarette consumption, and then the blue represents e-cigarettes. So as you can see, for youth and young adults, consumption of e-cigarettes is double to almost triple that of cigarettes. And when you look at the adult population, age 35 and over, there are more cigarettes. They are consuming more cigarettes than e-cigarettes. So e-cigarettes are clearly more popular among the younger demographics, with many of them going above 20%. So why does this matter? Well, if e-cigarettes were supposed to be brought to market or supposed to be used as a cessation device, then you would expect that e-cigarette consumption by the younger demographics would be equal to, if not less than, the combustible cigarette consumption rates. And that's clearly not the case. So as we had talked about the nicotine content in e-cigarettes, research is showing that the nicotine addiction potential is extremely high. And one study that was published in 2019 found that simply trying an e-cigarette puts youth at significant risk for addiction. 80% of youth who just tried an e-cigarette for the first time were still vaping 30 days later, indicating addiction. So let's just put it out there. Honestly, who do you see taking this vial? I'm not sure that's what they call them. I'm a nurse, so those are terms we use, and it sounds lethal, and these are lethal. So who do you see picking up this Donut Town strawberry-flavored e-juice? Is it the long-time smokers over the age of 35, or the tech-savvy youth below? And I really don't think that this marketing strategy is appealing to those long-time smokers who may want to quit. But for entertainment, let's investigate that question. Are youth actually using it to quit? Well, according to a recent study, only 8% of youth are using it to quit. And research evidence is inconclusive about whether it actually even is helping youth quit. In fact, most of them become dual users, which is not surprising because that nicotine addiction is probably increasing, and some research has indicated that the addiction is reinforced through the use of e-cigarettes by youth. So how are youth being reached with the marketing of e-cigarettes? Well, social media has been a very popular channel for reaching youth with e-cigarette marketing, especially by Juul. Research has found that it has influenced intentions to use as well as uptake by young people. And then there are also other more traditional strategies that have been used, including the radio and storefront ads. And then TV has actually become the latest marketing strategy by e-cigarette companies. This latest innovation must have significant potential because Juul invested over $57 million into their TV ad campaign in the last year. And Juul claims that these ads are aimed at helping adult smokers quit smoking, but research is finding that young adults and youth who view these TV ads are successfully being drawn into vaping. So that really makes you wonder, who exactly are these ads targeting? And that's an interesting thing, because when you think about the rules and regulations, you might be wondering, are they not allowed to be marketing to youth and young adults? So here are the ad restrictions. They have to comply to not marketing or selling to youth. They have to include a warning label about the addictiveness of nicotine. They cannot make any modified risk claims, and they have to provide a disclosure of ingredients. So I see a lot of gray areas here. Especially when you think about the addictiveness of nicotine, there should be a disclosure in terms of the amount of nicotine, in terms of disclosure of ingredients. When I go and buy food, I want to know how much sugar is in my food that I'm buying. And so I think that having these large statements without specifics can be dangerous. And not selling to youth or young adults, I want to focus on this one. Do we even know what that means? Do we have enough evidence to say this particular strategy targets youth and will appeal to youth in order to pinpoint that advertisements are or are not complying with regulations? And that's really what inspired me to run this study with 3 other colleagues. And so my research question for this study is, are companies tapping into young people's reasons for uptake in their TV advertisements? So the first part of this study, we ran a scoping review to collect all the different reasons that youth and young adults might be taking up vaping. We searched 2 databases, 2 literature databases. We only included literature that was situated in North America because the context of use as well as regulations are very different from, let's say, Europe or Australia. And we focused on youth and young adults because vaping rates are highest among these demographics. And we ended up with a total of 32 articles. So we inductively generated this framework of reasons for uptake, and they fall under 4 categories: personal, relational, environmental, and then product-related reasons. So the dark green categories are the most heavily cited reasons for uptake. So 15 or more articles cited articles cited that as a reason. The lighter green are the second most, so 10 to 15 articles. And again, they're very heavily cited reasons for uptake. And then yellow is the third most common, and then orange was the 4th, so the least most commonly cited reason. So we use this as a framework to analyze the TV ads that were available, and that was phase 2 of this study. So we searched a website called iSpot TV. This platform or this website provides all of the latest industry-led commercials for particular categories in North America. So that's why we searched this specific website. There were 10 brands being marketed, 10 brands that were using TV ads, and we collected a total of 38 ads from these 10 different brands. And this is what we found. And again, the dark green are the most heavily tapped into reasons. The light green, again, are second, and then that's followed by yellow, orange, and then the dark orange indicates that they really did not tap into that as a reason. Not surprising, smoking cessation was not really what their goal was. Their goal was more along the lines of innovating the cigarette, sort of maintaining that smoking behavior, not necessarily through the e-cigarette, not necessarily helping you quit nicotine. And we'll get into that a little bit more in the subsequent slides. But I just wanted to compare this because this is really quite eye-opening. When you look at the green, the dark green and the light green categories, the most highly cited reasons for uptake among youth and young adults were the most highly tapped into reasons by the TV in the TV commercials. That's pretty concerning because it shows that e-cigarette companies are covertly marketing to youth despite regulations saying that they cannot be doing that. So I wanted to pick apart, sorry, I just want to go back. I just wanted to elaborate a little bit more on the dark green and light green categories and talk about how these ads played into those reasons. So in relation to curiosity, I don't know if you've seen the article that was posted about 3 days ago, saying that curiosity is one of the #1 reasons why youth are being pulled into vaping. And so these ads use multiple contextual variables such as novelty, this is something new, uncertainty, it's the future, it hasn't been done before, this is innovative, this is an innovation, and innovation changes the world. And they even use certain conflict statements, like if you don't vape, cover your ears. is a statement that was used in one of the ads. Automatically, if I were a youth, even now, I want to hear what they have to say, right? And all of these tactics evoke curiosity and were heavily used within the commercials. Rewrite the rules. It's sort of, you know, it just sounds conflictual. Like you got to stand up against something that something that's telling you can't, right? In relation to minimal cost, many of the ads talked about money savings opportunities by purchasing an e-cigarette, for example. Your monthly costs will be less than if you continue to smoke combustible cigarettes. Many of them offered free starter kits, and most of them offered money off their first purchase as well. In relation to social acceptance and social capital. So social, I'll differentiate this. Social acceptance is about not being rejected and because of behavior. So smoking has become something where people feel like a social pariah, so much so that they're almost unwilling to seek support because they don't want people to know they're smoking cigarettes. And e-cigarettes is an opportunity to not be that social pariah anymore. Social capital is where if you engage in this behavior, you can enhance your social equality as well as the quantity of your social network. And many of the ads talk about how their quality time with their significant other or with their friends has significantly improved since they started vaping, and that they don't have to leave the house and miss out on life or social events because they're smoking. So that's what's meant by social acceptance and social capital, and many of the ads spoke to that, which is demonstrated in these quotes here. In terms of a positive sensory experience, the tactics in the ads focused largely on the variety of flavors that are available in e-cigarettes. In fact, there are over 7,000 flavors available on the market today. Also, they use spectacular graphic designs and sounds in the ads. Some of the ads didn't even use words. Some of them were just graphic explosions of color and fruit. and they had this like very emotionally, really emotional music, and that's how they promoted their product. They also, the ones that did use words and statements, they emphasized the satisfaction, they emphasized that it's not repulsive, that these e-cigarettes will awaken your senses. And so that's how they played into that positive sensory experience. And youth and young adults are particularly sensitive to this because at this psychosocial developmental stage, they are more sensation seeking. In relation to being discreet, there was an emphasis on freedom to vape anywhere, often juxtaposing e-cigarettes to traditional cigarettes, where traditional cigarettes were a form of bondage, and e-cigarettes would release you from that bondage. You don't have to go outside, you don't have to worry about the odor, and you can enjoy them wherever you are, whether you're in a restaurant, whether you're in a car, whether you're at home with your friends. And as I had said earlier, another big thing in the ads is that this is an innovation of the cigarette. It's not about quitting smoking. It's about continuing with the smoking behavior, but without all of the negative connotations that come with smoking traditional cigarettes. So these ads really aligned more with smoking than they did with quitting. And this is demonstrated in these taglines. I can still enjoy smoking. We know what smokers want. Make the switch. It's not let's help you quit. It's about switch from the cigarette to this cigarette. Arise from the ashes. So rise from the ashes of the traditional cigarettes and go into these clean, newer alternatives. And then we also looked at some other ad details, like the individuals that were depicted in the ads, as well as the context in which the ads were situated. So 50% of them showed people alone. There was a lot of interview-style ads. There was equal representation of males and females. Not surprisingly, younger age groups between 20 and 40 were the most prominent, so really kind of missing the mark in terms of who's smoking the most and would benefit from cessation, or not necessarily benefit from cessation, but the highest those who have the highest smoking rate over the age of 35. Almost 75% of the actors were white, and there were mixed contexts within the ads, with city and home represented the most. And I was sort of wondering, actually, this morning, why city and home were represented the most. And I thought, well, these are the contexts where smoking bans are the strongest. And so the emphasis is on e-cigarette freeing you from those regulations within those contexts. Can't smoke in the home, probably because of family-related connotations, and then in the city we have all these rules and regulations, right? There were other ads that had people smoking in cars, or vaping in cars, as well as vaping in the countryside as they're going for a hike, but those weren't as prominent as the city and home context, which I thought was quite interesting. So key takeaways from this study is that reasons for uptake of e-cigarettes among young people is multidimensional. Often we think of youth just not knowing about the harms, and they perceive e-cigarettes as harmless, but really it's more than that. As you saw, the various reasons young adults are taking it up are varied, and something that we need to pay attention to, especially in our efforts to curb vaping among young people. Also, almost all of the cited reasons were tapped into the ads, with the most prominent reasons played into the most, and those are the ones that I spoke to in the previous slide. So what are some implications about this? So as far as interventions go, we have a good start, but they're not enough. Many of our existing efforts are largely focused on consequences as well as what is not known, and as I had said previously, we need to focus on addressing all the different reasons that youth and young adults may be taking up vaping, as well as bring forward the issue of nicotine in e-cigarettes as well. I think that this is an issue that seems to be a little bit more in the background than it should be. For example, public health advocates have been celebrating that pregnant women are vaping instead of smoking cigarettes. But my question is, do public health advocates know that the nicotine content in e-cigarettes ranges so much? And are pregnant women aware of that? Because nicotine is what impacts fetal brain and lung development and contributes to low birth weight. And if they're consuming more nicotine in an e-cigarette than they would in a traditional cigarette, that's concerning and needs to be understood from a public health perspective. But also, research has said that many of these nicotine devices contain 2 to 3 times more nicotine than what's stated on the label. So that's another concern that we need to think about in relation to nicotine. We really need youth-driven approaches and content in order to develop meaningful interventions and tap into the variety of reasons that may be relevant for a particular group, region, or network. In relation to regulations, again, they're not strong enough. The general rules are enabling covert marketing to young people, which is demonstrated in this study. Taxes are going to be increased, so the PST is going from 7% to 20% on e-cigarettes in the spring. This will help reduce access, which is a positive step forward, especially since access was a highly cited reason for uptake. Flavor ban is needed. There's been a lot of back and forth about how productive a flavor ban would be for curbing youth vaping, but given that this positive sensory experience is a major draw for youth to take up vaping, I think that this flavor ban would be a positive step forward. And I read that PEI and Nova Scotia are really taking charge of that direction. Nicotine restrictions are needed. So if we are going to treat this as a cessation aid, then we need to align it with other cessation aids. For example, when you are using the patch to help reduce and quit smoking, there are guidelines, very strong guidelines about how much nicotine you start off with, and then you gradually decrease those nicotine levels. So if we're going to treat e-cigarettes in the same way, then we need to implement them in the same way. And so, in conclusion, this study really contributes to foundational evidence in relation to how e-cigarette companies are reaching young people, and our efforts to curb vaping need to be multi-dimensional in terms of intervention development and implementation, as well as in terms of regulations and policies. And so that's it for me, and thank you again for giving me this opportunity to present on some of my work.
Great, thank you very much. That's great, really interesting and very timely. We have time for some questions and comments. And so open it up to people online. If you have any questions or comments, you can just pop them in the chat box there, and Chiquetta will read them out. And I encourage you to do that anytime. Do you have any yet, Chiquetta? No? Okay. How about people in the room? Questions? Yeah, just speak up loudly.
Yeah, you bet. Thank you very much. That was excellent, Laura. I have two questions.
All right.
My first question, so forgive my ignorance, but I don't even know how much a pack of cigarettes costs and how much an e-cigarette costs. So can you tell me the difference?
So a typical pack of cigarettes, there is a bit of a range, but a typical pack is about $14. And e-cigarettes, they range. So you could get an e-cigarette kit for $7.95.
And how long typically would a kit last?
You know what? That's a good question. I actually don't know the answer to that. Yeah, sorry.
No.
I'll look into that though. Yeah.
And I guess my other question is do you know if there is any longitudinal study that started to look at the long-term effects, so the outcomes on the use of service systems?
So there are studies being implemented to look at the longitudinal effects, but we don't actually have, I'm trying to think of whether we have any kind of promising data in terms of what it looks like. John, can you think of something?
We do. There is some evidence to suggest that there are, if you vape over long periods of time, there are respiratory complications like that you can get, and no link to lung cancer yet, but certainly, I mean, you're bringing something into your lungs that normally wouldn't be there, so it's not surprising that lung-related complications over time might be a consequence of vaping. And then, of course, we've seen evidence of serious lung injury, is what it's being called, where youth or young adults, middle adults who vaped for not necessarily huge lengths of time because of their ages, end up in ICU or critical care because of the lung injuries that they've sustained. What's not exactly clear is what the causal mechanisms are yet, although there are some substances that are suspect.
Yeah, like the vitamin E acetate, which is commonly found in vaping products that have been mixed in with CBD oil. That's been associated with many of the lung-related injuries.
So my understanding is that you can't, youth or not, you have to be 19 to purchase these, is that correct?
Yes.
But when you can purchase them online?
Yes.
So anybody can.
Anybody. Yeah. You just have to click that you are 18 years old, or sorry, 19, over the age of 19, or 19, and you can get it delivered to your...
Is that the same for cigarettes? Can we buy cigarettes online? I wonder if, like,
Yeah.
I'm searching it right now.
I know when we talked to some Chinese fathers a couple of years ago, they were buying Chinese cigarettes online.
Oh, okay, so it must be available.
So I know they were doing that because they thought that the cigarettes in China were much better than what we sell in North America, and also I think they were less expensive as well.
Because that's if it's an access issue then, right?
Yeah. Well, just to put that in perspective, there are over 90,000 outlets that you can purchase e-cigarettes from in BC.
How many?
90,000. And in comparison, there's only 6,000 for combustible cigarettes.
Yeah.
So, sorry.
90,000 versus what?
6,000.
Okay.
Yeah.
And you can buy cigarettes
Online.
in Canada online.
Yeah.
CanadaCigarettes.org.
Oh,
But there used to be regulations about what kind of cigarettes you could buy, like you weren't allowed to buy American cigarettes, like, you know, I don't even know.
Glad.
This is very interesting talk. Like I was not aware of many of the facts, like especially the amount of like nicotine related foods into one, like and so on. So my first question is, like, is there any government or any other like initiative create awareness to reduce vaping? The second question is, I can clearly see that they are targeting more to young people and they are successful. But from the comparison graph, I can see that more young people are like more into vaping and so on. And this is probably because they are the population. They also use technological devices. So I'm just wondering whether there is any technological solution to control or to reduce vaping and so on.
Yeah.
Repeat the question a little bit.
Okay, yeah. So you're wondering if there are any government-driven initiatives that make use of technological platforms like social media to help curb use of young adult vaping. So I know Health Canada has a consequences campaign happening right now. And they are going all around the country into schools to present on the health effects of vaping. And that's more of a, I guess it's more of a prevention campaign. The issue that I have with that is just that it's focused on the consequences rather than the multi-dimensional aspects that contribute to vaping. And then there is a Public Health Ontario. I know some colleagues are working on developing an app for vaping cessation in Ontario that I'm not part of the team, but we're sharing information. Yeah, so I know there are things in the works. And then I'm also partnered with the BC Lung Association, and we're working on developing a solution that could potentially go online onto their web-based platform to support vaping cessation.
So I have a question here. How do you combat the idea that this is not harmful to your kids? It is hard to find direct evidence, and it sounds like preachy rhetoric.
Preachy rhetoric.
The extreme examples of hospitalized kids seem to be for those who smoke a lot regularly. What about those who only do it a few times a week or less?
So I guess my response to that, and it's hard to not sound preachy for sure, but I would say that engaging youth in exploring for information about vaping, about the effects of nicotine on the growing adolescent brain are important for them to know so that they can at least make an informed decision about whether they are going to continue with that behavior or not. Another major thing for smoking in particular is family approval of the behavior lends to taking it up and ongoing behavior. So family disapproval actually can go a long way. But in terms of informing the youth, I would engage them in that information gathering rather than you taking all the information and delivering it to the youth so that they can feel a degree of empowerment because they are smart and capable of making decisions, and so to bring them in that context.
I have another question.
Okay.
Yeah. Do you think the uproar after the recent vaping deaths was justified given the lack of conclusive evidence on its harms, and how comparative to cigarette-caused deaths is that number insignificant?
Well, it's hard to, you can't really compare it to cigarettes because cigarettes have been around for decades, and vaping has only exploded and become legalized in the last year in our context. So there would need to be a lot of time in order to make a true comparison. Do I think that, I think that these situations, we need to pay attention to what we're letting out into the market before doing our checks and balances. Like, I think there's a lot of checks and balances that were not in place before they were released, from what kind of chemicals are in these devices, to the quality of the devices, to the nicotine levels in these devices. But were put out there because they fell under this cessation aid category. But there were a lot of things that slipped through the cracks. So I do think that, you know, I think that there is some degree of panic warranted. But we still need a lot of research evidence in order to really draw conclusively about what to do about it. Should there be a ban? People have asked me that. Why don't we just outright ban it? Well, the problem is we do have people who vape and are addicted to nicotine, and so their go-to if we ban it is going to be smoking traditional cigarettes, which is not really what we want to have happen either. And so we just need to, as researchers, we need to, you know, keep trying to generate evidence as fast as possible so that we can confirm the next direction and how to move forward. But in the end, I would say if you don't vape, don't start. which is I think a tagline that's being used by a lot of health officials.
Okay, here's a big one. Although there is potential for 90,000 retailers, and that number came from Minister Dix, I don't believe there are 90,000 retailers selling vaping products. In Vancouver, 151 facilities selling tobacco-only products, 32 selling only vapor, and 232 selling tobacco and vapor products, and 68 age-restricted facilities selling tobacco and or vapor products. Interior Health, 955 retailers, and 232 selling vape products. Oh, okay, so stats.
Okay.
Yeah.
So that's helpful to know that.
Mhm.
Yeah, yeah.
Mhm.
No, thank you for that information. I do have I have that statement from Adrian Dix, but I don't have the actual numbers in that format. So something that I'd have to look into more deeply to understand what the specific statistics are in relation to retail numbers. Mm-hmm.
I have another question. Sorry. Is there evidence that vaping is actually more efficient than the other ways of quitting smoking, like the patches or the gum? Like,
no, there's studies that have been conducted. They are inconclusive about it helping people quit smoking, and have found that it more or less perpetuates nicotine addiction and lends to dual use. It seems as though, in keeping with the ads, e-cigarettes are a way to keep smoking, but in places and contexts where smoking is not allowed.
so then going back to your other statement to say, well, then if that's not the case, then why wouldn't a ban be a good idea? Not that I'm advocating, but if it's not working, then why can't we just
Harm
remove it?
reduction.
Yeah.
It's a harm reduction.
Yeah. Yeah.
Yeah, it's just another option, right?
Yes.
Yeah, okay.
Yeah.
We're kind of building on that. Like, I understand that it's not going to be banned, but understanding that stronger regulations that are aimed towards youth usage, that's probably the direction. I'm just wondering, like, where are policy development? Where is that state right now? And are you coming on local evidence towards that kind of thing? Or like that, what are the implications of these times?
Yeah.
I think you made a really good argument.
Mm-hmm. Thank you. I am hoping to leverage these findings with some of the connections that I have, both locally and provincially, and talk about the implications for potential policy development. I know that they are working on, I think there are constant iterations on what they should be doing, but here's some evidence that I can offer to add to the pile. And like Joan was saying, this could be a possible harm reduction method if it's done well and if it's done right and if it's done in alignment with other cessation aids that include nicotine in them, right? It's just, we need to stop this direct marketing to youth. Like Donut Town strawberry flavor is not really promoting cessation from a long-time smoker, it's really promoting uptake from a complete non-smoker. And so we need to nix that somehow and get on the right track. There's potential to get on the right track, but it's going to take a lot of work. And then we also have kind of collateral, because there's a lot of youth who are highly addicted to nicotine now that probably otherwise would never have been. Mm-hmm.
So Laura,
Yeah.
I know that particularly high schools, this vaping has been a huge problem for them. And so I'm wondering what you've observed in high schools in terms of them managing this issue or trying to address it. Mm-hmm. And if you've noticed whether some strategies so far, I realize this is at the beginning of this game, have been more successful or show promise, or somehow have been easier for schools to implement, or we're still trying to figure that out?
We're mostly just still trying to figure it out. So schools implement a, oh gosh, what's the word I'm trying to find? A consequence. Do you know what word I'm trying to find? Punishment. Yeah, they're kind of like a punishment if they're found vaping. The issue that they're having, though, is rather than having 2 to 3 students at a time, they have up to 200 students. And then they don't have resources or personnel to deal with the influx of students that need to be reprimanded. And the schools are recognizing, I think there was an article from the Vernon schools in particular, that punishing them for their behavior is not the way to do it. We can't punish our kids out of vaping, and we need to think of an alternative solution and work with these kids to develop that solution. So it goes back to that need for youth-led interventions to help curb vaping and discourage it amongst their peer networks and within the schools. So that whole punishing perspective doesn't really even align with health promotion, right? And there have been other strategies proposed, such as putting cameras in the bathrooms so they can catch kids when they are vaping, taking vaping away. There has been an initiative, and I can't remember which school did it, where they exchange the vapes for, I think, money? Yeah, or food vouchers. Yeah, so taking a more positive approach to curbing the behavior, and I think that was received quite well. In comparison to the more punishing, taking away, we're monitoring you, big brother type of approach. So, but again, it's sort of like we're all just throwing things out there, but we're not sure which direction to go. And I'm hoping that some of my research will shed light on more promising directions, and particularly want to co-design these things with youth, and hopefully that will help. Yeah.
Somehow we have to make it cool not to vape.
Not always a challenge.
Yeah. Well, I think, it's not even just the cool factor. There is that influence amongst peers that make it acceptable, and it can be cool because you can do tricks with it. But there are so many other factors, like the mental health of youth is contributing to the uptake of vaping. Nicotine relaxes you. There's a lot of high rates of ADHD and inability to focus. Nicotine helps you focus. Youth have never suffered from less sleep in like the history of time, apparently, and nicotine makes you feel more awake. So youth aren't just doing it because it's cool or because they don't know about the harms. There are just all these other different reasons, and so our interventions need to honor that and be tailored according to that. Because if the youth is vaping because they're feeling anxious, that has huge implications for our interventions. Telling them about the harm is not going to do anything for that particular youth, right? And so that's why I'm wanting to reinforce that co-design approach to developing interventions for youth.
Mm-hmm. So I have another question here.
Yeah.
Did your research differentiate between Canadian and U.S. advertisements? And if so, was there a significant difference in between them?
No, so all of these advertisements were U.S. driven. Yeah, they are distributed across North America, but they were driven in the U.S.
And is this because the vaping the companies producing vaping products are mostly in the U.S.?
Mostly in the U.S.
Okay.
Yeah.
That's it.
That's the question. Anyone else? Yeah.
Just one. So I'm just curious to know whether there is any smart e-cigarette where actually I can keep track of my intake information from a website or something.
Oh yeah, lots of e-cigarettes now have an app where you can track how many puffs you've taken, where your levels are at. Yeah.
Oh, really?
Yeah.
So might those be used to help you reduce and stop vaping?
I think there's significant potential to leverage that, what they put in place for us. Right? Yes, absolutely, I think so.
Yeah,
Yeah.
because I guess what might be helpful for people to know is what Quit Now or BC Lung are advocating in terms of the best way to stop vaping if you if a youth or anybody wants to stop, how do you do it? I mean, we have lots of advice about how to quit smoking, but what's the advice that's being given now about how to stop vaping if you want to go in that direction?
Well, they're honestly, it's pretty similar to how to stop smoking at the moment. And yeah, if you look on the BC Lung website, there's a lot of information about vaping. And then in terms of cessation, they talk about options for alternatives like NRT, so the patch, the gum, lozenges, the spray that you can use. And then I think they offer their coaching service as well, so you can talk about it, talk about the difference.
Or you could just gradually reduce your vaping if you could somehow figure out how to do that.
Yeah, such as through tracking your behavior. Yeah.
Great. Wow, this has been really great. Thank you, Laura.
Thank you.
A great presentation.
Thank
Good
you.
timing because of National Non-Smoking Week. And, you know, clearly an issue that's going to be at the forefront of the field of health promotion, public health, and tobacco control experts across the country for a few years to come, I imagine. And it's going to be an increasingly issue for us here on campus. Our team with Campus Health have begun to try to provide information about vaping because we realize that many of those high school kids are going to transition onto our campus. And we're beginning to think about what impact that might have for our campus and how we might want to address that. And so if you're interested in working with us or have some ideas, we'd really welcome your participation. So, but I do want to end by thanking Laura for this great talk. Thank you very much, bringing us all up to date, and thank all of you for coming today, both online and in the room, and for all your great questions. It was really fabulous. We have other webinars or seminars coming up, one actually on Thursday. So I welcome you to join us and check out the Institute for Healthy Living webpage, and you'll find all of our future events, including very soon we'll be posting all of our events for Embrace Aging. So stay tuned for that. There's a whole bunch coming up in March, and look forward to seeing you again.